Hi, I'm Dr. Anton Janssen van Rensburg. So let's kick off the CBD Dominant Products. And now I'm talking about a CBD drop, and the easy way to remember it is that you can literally use it for any condition. This is probably the product that you will use the most as a startup for a condition. We use it for seizures, for chronic pain, and all the whole range of chronic pain conditions. And we also use it for spasticity due to multiple sclerosis, things like movement disorders, Parkinson's, things like that. And then the whole pain grouping, the arthritis, the osteoarthritis, rheumatoid arthritis, psoriatic arthritis, the fibromyalgias, all the pain conditions. A good place to start is your CBD dominant product, but also for your older patient who is cannabis naive, I find it's just better to start with a high CBD product. Remember, there is THC in this product because we want the medicinal effect of the THC. But you will start with a higher CBD, it's just less side effect. It just works better that way, and your patient will stay on the product for longer. So let's start. So all my patient examples in this presentation are real patients. I've just changed the names. These are patients that we've now treated, myself mostly, but also some of my colleagues. And this patient is a 65-year-old male, Chris, very severe progressive rheumatoid arthritis, the typical where you see all the deformities in the hand. And this particular patient had hip replacements, had surgery to his hands, and really came to a point where the opioids and the anti-inflammatories, he had every single side effect because of all this medication. So here's my titration that's on the Intrigant portal that I gave him for a CBD dominant product. In his case, I gave him a 25-part CBD, 2-part THC product that you'll find. There's a whole list of products that are on the portal that you can find there. And this is how we titrated Chris towards feeling better. Now, in his case, I'm showing you the whole titration. Some patients may stop halfway and say, I found my dose, but in his case, we went to the full 42 drops per day dosage. But at that point, Chris could start weaning himself off the opioids. He was using less non-steroidal anti-inflammatory drugs because he already had gastritis. So just such a lovely outcome for this patient. And also as a doctor, to have this patient come to you and say, you know what, I'm doing so much better. I'm not drowsy and I don't feel like a zombie because of the opioids anymore. And, you know, my stomach is working. So this was a very nice patient.